Let's start with one of the common vascular diseases which is athersclerosis أو ما يسمى بالعربي تصلب الشرايين. As you may recall from vascular histology, the arteries and veins have three main layers. The innermost layer, which is in direct contact with the blood and called tunica intima, and the middle layer, which is made of muscles and is called tunica media or the media, and the outermost layer, which is called the tunica adventitia. In atherosclerosis, the lesions are centered mainly within the intima, the innermost layer, and they are called atheromas or atherosclerotic plaques that protrude into the vascular lumens. Atherosclerotic plaque is made of fibrous cap covering a central soft core. The soft yellow core is made of cholesterol, cholesterol esters, and necrotic debris. This diagram demonstrates the location and the main components of atherosclerotic plaques. As you can appreciate, moving from the innermost layer, which is the endothelium at the top of this picture, followed by the fibrous cap. This fibrous cap is made of smooth muscles, macrophages or foamy cells, some inflammatory cells like lymphocytes, and collagen, elastin, proteoglycans. All those are supported with a new blood vessel formation, which we call neovascularization. The fibrous cap is covering a soft yellow center composed of necrotic debris, and that's why we call it the necrotic center. This necrotic center is made of cellular debris, cholesterol crystals, foamy cells, and calcium. As you can appreciate from this diagram, the uppermost layer is the endothelium, and the lesion is trapped between the endothelium in one side and the internal elastic lamina, which is highlighted as dashed blue lines, so all the lesion is centered within the intima. And the media is separated from this lesion by the internal elastic lamina. Coronary artery diseases and ischemic heart diseases are considered as an important manifestations of atherosclerosis. So the epidemiologic data related to atherosclerosis mortality typically reflect those that are related to ischemic heart diseases. Myocardial infarction, which is one of ischemic heart diseases, is responsible for 1/4 of deaths in the United States, for example. The mortality rate of ischemic heart diseases in the United States is among the highest in the world. Risk factors for atherosclerosis. These risk factors have roughly a multiplicative effects. This means that if the patient has two risk factors, the risk will be increased for myocardial infarction or other manifestations of atherosclerosis approximately by 4-folds. If the patient has three risk factors like hyperlipidemia, hypertension, and smoking, then the risk will be increased by a rate of 7. Risk factors are classified into major constitutional non-modifiable risk factors and major modifiable risk factors.